This short slide presentation provides you feedback regarding your performance for the recent lumbar spine assessment. This assessment evaluated your ability to localize and determine the relative positions of landmarks in the lumbar spine, tasks that are fundamental in diagnosing somatic dysfunction. The data that I'm going to present are examples of students' performances from the baseline assessment in July and the recent lumbar assessment to help you understand how to interpret your performance scores. So why is this testing important? Accurate localization of lumbar anatomy is relevant to manipulative medicine, where good diagnosis requires accurate localization and assessment of landmark asymmetry. But accurate localization also helps to determine what osteopathic technique is performed. When this test is performed after a technique, evaluating positional asymmetry also helps DOs to determine treatment effectiveness. Accurately localizing lumbar anatomy is also relevant when performing epidurals for surgical anesthesia, for pain management during labor and delivery, for performing lumbar punctures to evaluate cerebral spinal fluid in children and adults with high fevers of unknown origin, or for other diagnostic or treatment procedures such as discograms or facet blocks. All of these procedures require accurate landmark localization by palpation to minimize the risk of causing an adverse event to a patient. So let's look at the results for the lumbar model assessment. Consistent with the format you received from your feedback after your baseline assessment, this figure allows you to compare your performance at your recent assessment with your baseline. The data related to the lumbar model assessment is in yellow, with the length of the bars indicating the number of classmates who achieved that particular score, as noted on the y-axis. The red dots indicate your scores on both tests. The black bars indicates the class's median average, demonstrating an approximately 35% improvement in the score from baseline. In this slide, you can compare your accuracy based on direction of asymmetry. In this case, there is a 25% better performance when the right thumb is anterior versus posterior. This likely indicates that your perception is being skewed based on some aspect of your technique. You can get additional information from this table. In the gray bar, you can see the actual asymmetries for the different directions on the exam. In this column, you can also look at the asymmetries to see at what level you are consistently correct in your assessment. This demonstrates your accuracy threshold. Our goal is with each assessment, your accuracy threshold gets smaller. You can also look to see if you are more consistently correct with the right transverse process being anterior or posterior. An imbalance, performing much better in one direction versus the other, indicates some sort of systematic skewing or error in your technique or perspective. At a help session, you can get some individualized feedback to help provide clues for identifying sources of error. With this knowledge and practice, your skills will steadily improve. So here's an example of a potential cause for a systemic imbalance. In photo A, you see this person positioned so that their head is tilted to the left, bringing their left eye closer to the model than the right. You also see that the head is displaced to the right of the model, further complicating the geometry in the visual assessment from one landmark to another. When we look at photo B, we see that this student's skill has brought her eye more into midline and that the eyes are more level to help her see things more accurately. And then when she bends down to be able to see the landmarks within that horizontal plane, you can see that her dominant eye is in the midline and that there is no tilt to the head. So now what? First, I hope that all of you appreciate the significant improvement that the class has demonstrated from the baseline assessment to the recent assessment in just less than 2 months of your curriculum. Please continue to practice and to advance your skill with models so that you can assure in your skills a consistent high level of accuracy. The next step is to translate the skills from models to people. Since every person has unique characteristics, it is important to regularly practice the consistent, systematic diagnostic approach you developed on the models on different types of people to further advance and to refine your clinical skills. By attending practice sessions, you'll be able to overcome areas of confusion or tasks that do not seem like they are improving. For those who did not meet the 70% passing standard for this assessment, extra practice and retesting is required until you get at least a 70%. You will receive a follow-up email informing you of the remediation process.